All of these are things you can do under your ideal circumstances, when you have the time to discuss things calmly. However, in an emergency, time can be critical. You need to be able to communicate immediately. As soon as you arrive, let the urgent care or emergency room intake person know that you're deaf, deafblind, or hard of hearing and ask for a qualified ASL interpreter. You can't expect them to know your needs if you don't tell them, but you can expect them to meet their obligations. It's important to stay as calm as possible. Be respectful to everyone, but keep repeating your request in writing until you have the communications assistance you need. This isn't the time to say you'll be contacting a lawyer or threaten to sue. You need to focus on getting the medical attention you need.
Emergency situations can be very emotional, and it can be hard to keep track of the details when doctors and nurses are coming and going. I'd suggest doing these things. First, request a qualified interpreter in writing. Note the date, time, and the name of the person that you asked to provide the interpreter. Ask to see the person who coordinates interpreting services so that they understand that you need an ASL interpreter and that they are being held accountable. If the hospital representative says that they use a video remote interpreting service, or VRI, ask them to provide access immediately. If you've requested an on-site interpreter, ask when the interpreter is expected to arrive. As I mentioned before, document the time and the name of the person you spoke with. If the hospital's representative says they want to communicate with you through a hearing family member, let them know that this isn't acceptable. Repeat your request for an interpreter in writing, then keep a copy of the note. If the hospital or doctor is writing to you, it's important to write that you don't understand or that you can't express yourself clearly in writing. Don't be embarrassed about this. If you don't write that you don't understand, the hospital will think that you do understand and will think that writing is an effective way to communicate with you. The hospital may later tell a judge that an interpreter was not necessary because you understood what was written and could write back. Repeat your request for an ASL interpreter in writing each time. Again, keep a copy of every note. Ask for copies of the notes that they write to you as well. If you've been in the emergency room for a while, periodically ask the nurse or doctor in writing if an interpreter has been contacted and when the interpreter is expected to arrive. Keep their written responses. Try to be polite and respectful, but firm. Remind the staff you have the right to get an interpreter. If you don't think the hospital is responding, contact the head nurse or the hospital's patient advocate. Keep copies of all the notes and ask for copies of other people's notes as well. Once the interpreter arrives, make sure you understand what both the interpreter and the staff are telling you. Your health is too important to take chances with. Be honest about your understanding of your medical situation.
Once the emergency situation is under control, you may need to be hospitalized or receive further treatment. Hospitals and clinics are required to provide access to a qualified interpreter throughout your stay. This doesn't mean that an interpreter will be sitting by your bedside 24 hours a day, or that you can ask for an interpreter in order to request another pillow. However, it does mean that the hospital should schedule a qualified interpreter to be available several times during the day so that you can communicate with your doctor, understand treatments or procedures, and participate effectively in therapies. This also ensures that you have the scheduled times to ask questions. The interpreter coordinator is usually responsible for making sure that doctors and other providers are available when the interpreter will be on site.